Hi, I'm Jen Regal. I am a naturopathic doctor and the co-founder and medical director for Integrative Healers Action Network. Today I wanted to walk you through SCOPE, the SE Crisis Stabilization and Safety Aid. At Integrative Healers Action Network, it is our main goal and mission to bring integrative health to those that are impacted by disaster. And so I have a lot of experience being in disaster with integrative health practitioners, and I am one myself. And I can tell you one thing that's really important is that oftentimes we are seekers in integrative medicine. We are on a path where we are working to improve ourselves, and we have a lot of resources. We also tend to be empaths, and not always, but a lot of us tend to really deeply feel what those around us are feeling. And so I want to make sure that you understand the SCOPE tool so that both you can use it for yourself, and when you are working in disaster, you can also recognize and use it in people that you're treating. So something that's important, back to my original point about integrative health practitioners, is that a lot of times I see an indication from people that they don't think that they'll need these tools. We forget that we have them when we go full heart forward into disaster work. And it's really important to take moments to recognize where are we at in our nervous system, because we are impacted like everyone else. So the SCOPE tool is a great quick tool for you to check in with yourself. You can carry it around in your pocket. You can use it for yourself and practitioner and clients. And you can take advantage of the ease to which you can use this tool. So SCOPE, the S stands for slow down. So take a moment to slow down, walk slowly, intentionally put each foot on the ground and notice the sensations that you're feeling in your body. C, connect to your body. So one way to do that is to cross your arms and ankles and tuck your hands or your hands under your armpits and lower your head and just breathe for a moment. Next, one of my favorites, orienting. So if you really feel like you or someone else is having a very difficult time, it's one of my favorite things to do with people who are having a panic attack, for example. Help them orient to the safety in their environment. It can be a hard thing to do with someone having a very difficult acute moment to tell them to take a deep breath. It can actually make things worse sometimes. But orienting to the environment is a very safe way to help get them back in their body and experiencing what's actually happening in this moment. So orient to safety. It can be something neutral. You can ask them to notice colors. You can ask them to notice that there's a plant next to them. Or you can invite them to notice what they see in their environment and engage with them about that. Next is pendulation. And so this is a very important thing to recognize for our practitioners as we are treating people in disaster. One of the things that we want to focus on is to not bring someone from such a deep state of despair or tension into a deep state of relaxation all at once. It can really backfire. So we need to pendulate, which means we need to go back and forth. And you can also do that with yourself. You can notice in your body, where are you feeling tension and where are you feeling ease? And just let your attention move back and forth between those spaces. You can also direct people to do that as they're sitting on your table if you notice that they're having a difficult time. Engaging. So engaging socially. It's very, very important to us that people who are volunteering with us, and important for people who are in any particular portion of disaster work, or those who aren't involved with disaster work that are impacted by disaster, that we have community. Reach out to someone. Find a number of someone that you know will support you well and give them a call. Community is such an integral part of our beings, and we need it for our health. And so don't hesitate to reach out to someone and just be with them. Just be with them about your experience. Just be with them about how you are in this moment. Thank you for tuning in today. Really appreciate the SE Trauma Institute and the collaborations that they have opened up, and looking forward to having this scope tool out and available for practitioners of disaster work and those impacted by disaster to use.